Hi everyone. Today I am going to discuss a very challenging and very important topic for the NEET and not for the NEET examination. This topic is always useful when you are doing or you will do your MBBS for saving the life of the patient. So this topic is ABO system. The ABO system defines four main blood groups. Blood group A contains A antigens in red blood cells and anti-B antibodies in plasma. So depending upon the presence of antigen and antibody, antigen is present on the red blood cells, whereas antibody is present in plasma. So for blood group A contains antigen in red blood cells and plasma contains anti-B antibodies, whereas blood group B it contains B antigen in RBC and anti-A antibody in plasma, whereas blood group O lack antigens but receive A and anti-B bodies, anti-B bodies in plasma. So we have seen that in blood group A, there is A antigen is present in the red blood cells and antibody in plasma, whereas in blood group antigen is present in B antigen is present in RBC, whereas anti-A antibody in plasma. Blood group O lacks antigen, but it contains both anti-A and anti-B antibodies in plasma. So blood group AB and other blood group is AB. It contains both A and B antigens, but no antibody in plasma. So इसमें we have seen that blood group AB contains both A and B antigens, but no antibodies, whereas blood group O contains antibodies A and B, but no antigens. So depending upon this presence of antigens and antibody, we decide the blood groups. The ABO gene located on chromosome 9. Remember this, it comes in the your NEET PG examination. So ABO gene is located on chromosome 9, is responsible for encoding the enzymes that produces these antigens. The gene exists in three main alleles, that is capital 1A, that is I indicates for the antigen. There are three types of allele, IA, IB, and a small I. Each person inherits one allele from each parent. So you memorize this table, which is very helpful for you to learn the ABO blood grouping and determining the blood groups by very easy method. So this is the inheritance pattern of blood group. It follows a Mendelian genetic pattern where capital IA and IB are codominant and both are dominant over a small I, that is gene for the for the blood group A, B, and O. If capital IA or IA small I individuals will have type A blood group, whereas the person who has only a small II individuals will have type O blood groups. So in this table, I make very easy table to understand what the blood group, if mother blood group is known and father's blood group is known, then what is the possibility of child blood group? So you can memorize or you can remember this very easy table. Uh, it looks some bizarre or some difficult, but it's very easy table to memorize. So you have to remember that if mother and father blood group is O, then child blood group never be AB or ABO. It is always O. So this ABO blood group is also used in legal uh, process to identify the uh, identify the child's identity with mother, or it belongs to the mother side or father side. So depending upon that, it also legal implementation, legal implementation for this. Likewise, there is another blood group system, that is RH blood group system. Father is RH, mother is RH, and child's RH. Father's and mother's RH determine the RH factor. So anti-D, RH factor means anti-D is used. If anti-D is present, then it is RH positive. If anti-D is not present, then it is RH negative. So you can remember or memorize this table to know the RH factor. So come to the question. A person with blood group AB has no antigen on RBC, but both anti-A and anti-B antibodies present in plasma. Second option, antigen A on RBC and antibodies in plasma. The third C option is antigen A and B on RBC, but neither anti-A and anti-B antibody in plasma. And D, antigen A and B on RBC and both anti-A and anti-B antibody in plasma. So what is the correct answer? If you go to the this, so blood group AB contains both A and B antigens, but no antibodies in plasma. So what is the answer of this? So it contains antigen A and B on RBC, but no antibodies in plasma. So answer is C. Now come to this very important questions. Many times it has asked in many medical examination, whether it is related to the PG after the MBBS, or even in the NEET examination, NEET use examination. A person with unknown blood group under ABO system has suffered much blood loss in an accident and needs immediate blood transfusion. His one friend, who has a valid certificate of his own blood type, offers for blood donation without delay. What would have been the type of blood group of the donor friend? If you know that, the which blood group is universal donor, or which uh, blood group is universal recipient. So you must know that universal donor is type O. So in this, this is a the patient has this is very serious condition. So in this condition, the universal donor is type O blood group. So definitely blood group O is transfused to uh, save the life of the person. So the answer is type O, because this is the universal donor, whereas type AB is universal recipient. Now come to the another question. The universal donor and acceptor will be. So I already discussed this, the universal donor and acceptor. So universal donor means the person who donate his blood to any blood group, and universal acceptor, the person who accepts the blood from any person. So in this scenario, the answer is O negative is universal donor, whereas AB positive is universal acceptor. For that explanation, you just go to the back of my slides, where I have explained which group is required antigen, or for the classification of A, B, and O group. The antigen is present or antibody is absent in the plasma and RBC. Accordingly, then you will identify which group is recipient or donor. Now, fourth question is ABO blood grouping is based on presence of two surface antigens, absence of two soluble antibodies, presence of two surface antigens. So, if you remember the previous discussion, just I discussed regarding the ABO blood grouping. then it could be the answer is two answers: absence of two soluble antibodies and presence of two surface antigens. Antigen is present on the RBC surface, whereas antibodies they are present in plasma. So answer is both 2 and 3. Now this is very tricky question and very important question. In the following table of human ABO blood group, fill up the blanks 1, 2, 3, 4, and 5 from the option given below. A blood group, antigen on RBC A is correct. Antibody in plasma, NTB, that is also correct. And donor groups A and O. So the person from the A blood group can receive blood from the A group or O blood group. Similarly, B person also receive B and O group. Now, so we have to identify what is 2, 1, 3, and 4. So this is AB, blood group AB. So antigen on RBC is AB, and antibody in plasma 2. So 2. 2 means there is nil, because antibody in AB group is absent in plasma. So it is nil, 2 is nil, then AB, and it can, donor could be AB, A, and O. Now blood group is O, antigen RBC 1. So antigen in RBC is nil, whereas in third, the antibody in O blood group is present, anti-A and anti-B. So answer is for this is D. So blood group chapter is very important chapter, and I make very small video for this because I want to continue this chapter uh, uh, slightly long. So video बड़ा हो जाएगा. So I make very important topics included in this first video of the ABO blood group. So my request you to just go to the chart what I have given in the early explanation of ABO blood group. Kindly request to you share, like, and comment for this video. Thanks for watching, and thanks for giving your time. Hope with your comments I will able to write or make more topic